Hundreds of future doctors are in Kansas City today for a very special conference.
The main topic this year, food as medicine. Our Matt Stewart is live at the Lowe's Hotel downtown with the details. Hey, Matt, good morning.
Good morning. Yeah, it's the American Association of Colleges of Osteopathic Medicine. And we're going to talk about osteopathic medicine in just a minute. But common sense tells you, right, that when you look at a plate and you see a bunch of vegetables that just fell on the floor, you know that it's a lot healthier than a plate of bacon, right? But doctors now are really focused on how food plays a part in causing maybe different kinds of cancers or different kinds of health problems that we deal with every day. And joining me right now, I have Dr. Robert Cain. He is the president of the AACOM. We'll just use the acronym, it's a little easier. But first of all, for our viewers at home, Dr. Cain, tell us, what is osteopathic medicine?
So osteopathic medicine is a whole person approach to the practice of medicine. It's very philosophy based. We think things like the body has the ability to heal itself, that the holistic approach, mind, body, spirit, is important to well-being. And it fits very well into this conversation about food as medicine.
Let's talk about that. That's the big topic today on the last day of your conference. This is a national conference here in Kansas City. Talk about that. What do you mean food is medicine? What are you trying to teach these future DOs?
So first of all, this is our national conference. We have over 1,000 people here, osteopathic educators from across the country. We have university presidents, medical students, and everything in between, deans, faculty, staff. The point of today's part of the conference is to actually focus on food as medicine. As we look at medicine over the last century, it's become more focused on disease and managing disease, not on preventing it. Recently, we've seen the government looking at the idea that, well, prevention can help us to not only keep our population healthier, but reduce healthcare costs. We get better outcomes for everyone. So what we've decided to do is actually live part of our history and focus on that principle of the body has the ability to heal itself by making sure we give it the right tools. And nutrition is one way to start that. Making sure good food is understood by our doctors so they're able to have the right conversations with patients and then hopefully begin to see the changes in things like hypertension and diabetes control.
So in a sense, instead of taking medicine in a bottle, certain types of foods can help you feel better. It can kind of solve those health problems that you're dealing with?
Absolutely. If we take something like high blood pressure, if you look at the label, on the nutrition label, on most of the processed foods that you're eating each day, very high sodium content. That'll help to drive up your blood pressure. You show up at your physician's office, we're not able to do anything about diet, haven't been able to for a long time. We write a prescription, we send you out the door, we tell you to eat healthier. Blood pressure may or may not become more controlled. But with the changes people are starting to think about is how can we actually prescribe food to you as a way to control that blood pressure? Get that salt content down and watch change begin to occur. You may still need medicines, but maybe less or less numbers of medications to achieve the same outcome.
I love it, Dr. Cain. Thank you very much for explaining all that. I appreciate it. And that's exactly what they're going to be talking with these future doctors and with these administrators from all these colleges across the country. Kansas City University being one of them. And so, yeah, they're doing what they can to really prescribe food. I mean, who thought about that? But it makes sense. It's interesting because you think doctors prescribing medicine, not necessarily prescribing a diet. But we're going to talk in our next 2 hours with some other doctors of osteopathic medicine about, maybe the types of foods you should be looking to eat and the ones you should be trying to avoid. So that's coming up in our 8 and 9 o'clock hour, guys.
All right, Matt Stewart live downtown at the Lowe's Hotel. Matt, thank you.